It really came to a head because Ben was going to be having surgery
Right.
for his tooth, and I know that the standard process in that situation is for the anesthesiologist or the surgeon to come and say, and whatever other choices you have around his life, if something happens in the OR, dang it, we're doing everything, and to have a more nuanced discussion. And happily, I think we had a very thoughtful anesthesiologist who was part of that discussion. And
We did.
So it opened a territory, a box that needed to be opened anyway. And then the form that we used then was something in Massachusetts. It's called the Comfort Care Form, which is being phased out, but for a different form. The Comfort Care Form I always think of as insurance, because it does keep choices open for families. In the moment, you may make the decision that's right for that moment, but if you don't have a Comfort Care Form and you were thinking that you did not want an intubation or an attempt at restarting the heart to happen, that's out of your hands unless you have a form that allows the pre-hospital personnel to stand down from their standing medical orders. They have to do what they have to do unless they have a signed form. So you don't have to show it to anybody, If in the moment you would like, in fact, absolutely anything that the pre-hospital folks could do to be done, they will do that. What they won't do is not do that if you don't have the form. So
Right.
I typically talk about it as a kind of, let's just keep choices open because it will be clearer to you in the moment than it might be now.
Yeah, and that was a good conversation. And I was not aware of that form or the process, or even that an ambulance personnel wouldn't listen to if you conveyed to them that you didn't want your child intubated or whatever, that they actually didn't have the authority to let you make that decision. So it was great, and I can remember pinning it up on my bulletin board upstairs in my office just so that everybody knew where it was should the circumstance arrive. And then I can remember traveling, actually. We went somewhere with Ben, I don't remember where, but and taking it with me just so that we had the assurity of that being, present with us. And again, having the conversation with Pat that says, on that Tuesday, if you need to call the ambulance and you've decided something different or you feel differently, just don't show them the form. And it's, again, it was a way to put the power back on to me, and that gives you some assurance and some comfort in your life when you know that some of it is especially when your child has a medical disorder that's so out of your control, right? Because we can't do anything. There aren't even really good drugs or anything. So it was helpful, certainly at that stage. And it also got us thinking about the next time and the next time. And we needed to start doing that.